Hello, and welcome to the Liberal Conservative. I'm Rob Carey. Healthcare, or better yet, healthcare reform, has historically been a hot-button topic in U.S. politics. President Trump's healthcare reform bill has successfully made it through the House and is on its way to the Senate for a vote sometime in the near future. I believe now is the perfect time to go over some of the perceived pros and cons of the Affordable Care Act. The Affordable Care Act provided over 20 million Americans with health insurance. This group of previously uninsured people are able to have checkups and testing done. This lowers overall health care costs because this preventative care efforts lessens emergency room visits. The average ER visit costs $1,200 according to the Blue Cross Blue Shield website. The downside is that there is a short-term increase in health care costs because of the extra doctor visits and testing being done. The Affordable Care Act required all health insurance policies to cover 10 essential benefits, some of the required benefits being treatment for mental health, addiction, and chronic diseases. In the past, insurance companies did not cover these treatments, so the cost would be covered by Medicaid or Medicare, effectively passing the cost on to the taxpayer. But with the Affordable Care Act, approximately 30 million Americans had their health insurance plans canceled because the plans they were on did not meet the 10 required essential benefits of the Affordable Care Act. No one likes to be sick. Imagine finding out while you're ill that your health insurance has dropped you or jacked up your rates. With the Affordable Care Act, insurance companies could no longer deny coverage because of pre-existing conditions, nor could they drop coverage or increase premiums because of illness. Starting in 2020, insurance companies would be assessed a 40% excise tax on Cadillac plans. These are plans that annual premiums exceeded $10,200 for individuals and $27,500 for families. They are generally for high-risk pools individuals. This 40% tax would most likely be passed on to the people through increased premiums and deductibles. No lifetime coverage or limits. Again, this is similar to finding out you've been dropped from your health insurance while you're sick. No one wants to be midway through treatment and find out you've maxed out what your health insurance is willing to pay. The Affordable Care Act raised taxes on individuals earning $200,000 or more and couples earning $250,000 or more. This is an increase between 1.45 to 2.35%. Simply put, no one likes to pay more taxes. Children could stay on their parents' health insurance policies until they reach 26 years old. This is a major win for insurance companies because they can collect premiums for these young individuals, which are generally the healthiest pool of people. Healthy people mean fewer doctor visits. Medical expenses can only be used as a federal deduction on taxes when it's greater than 10% of the annual income. In the past, medical expenses only had to exceed 7.5% of income. Businesses with more than 50 employees must offer health insurance. The business would receive tax credits for providing this insurance, but 3 to 5 million people lost company-sponsored healthcare plans because businesses found it more cost-effective to just pay the penalty. No healthcare reform plan is perfect. The goal of any governmental reform plan should be to improve the conditions for most citizens while limiting the negative impact for others. Hopefully, President Trump's reform plan does just that. Thanks for watching.